think there are a couple of questions that might not have been answered completely or something else. But first, I'd like to ask maybe from each group, the facilitators to maybe tell us a little bit about some of the discussions, some of the important elements that you have identified. Are there things that you'd like to share with us that could be of interest to everyone from the group? So we'll start with group 3, then group 2 and group 1, and we'll give you 2 or 3 minutes each to tell us a little bit about the discussion you had. So the facilitators for group 3, you had a particular focus on distribution, procurement practices, and management and training resources. Would you like to tell us a little bit about some highlights of your conversations?
Hey everyone, I'm Connor House. I'm also a project manager at PATH, working closely with the team that you saw present today. So I was facilitating group 3, where we talked about distribution challenges, procurement, and training. It sounded like of those 3, you know, the big concern is oxygen distribution in country, which is not all surprising. It sounded like a lot of countries up until COVID had actually not, you know, this oxygen distribution had not even been front of mind. There weren't task forces, there weren't groups working on it. Since the outbreak of COVID, this has become a front of mind concern. And we had pretty good regional representatives in our breakout group from Kenya, Zambia, and Somalia, and everybody experiencing the same challenges with oxygen distribution. You know, when it comes to cylinders, liquid oxygen, even maintenance and repair of oxygen equipment, you know, everything is very challenging. I think a desire and maybe a next step was to figure out what are other countries doing? Are they doing baseline assessments? Are they bringing in consultants to understand where the needs are? How are other countries addressing this? And that's a big question we couldn't get into in depth because a lot of countries do a lot of different things. But I think that'd be one thing for follow-up, is maybe understanding how other countries address this issue. Going hand in hand with distribution is procurement. We also discussed, you know, the appropriate matching of supply to different needs when it comes to oxygen infrastructure, and how procurement's also been a challenge in many countries, especially in countries where procurement's decentralized and different guidelines and different practices, you know, make up the procurement efforts across an entire country. So I think that's somewhere else where maybe cross-country learning can be helpful, because there's many different countries like Kenya, India, Indonesia that have similar decentralized procurements, and then there's some countries with more centralized. And I think also our procurement guide can help with that a little bit as well. So I encourage folks to check that out. We spoke less about training. It sounded like training was less of an issue. A lot of countries have prioritized training in medical oxygen to, you know, especially amid COVID. It's an ongoing activity that's always happening. It's not something that you stop investing in, but it sounded like that was less of a concern. So that was group 3 and what we spent some time discussing. Thank you.
Thank you very much, Connor. Thank you so much. Group 2, you had a conversation on the understanding of the oxygen needs and use. So would you like to share some of the highlights of the conversation? Group 2, I think it was.
Yeah, sorry about the Pascal. I was just waiting if Spike wanted to start us off. So in group 2, we were discussing the quantification and costing tool and the baseline assessment tools. I think we had a very productive conversation both on implementing the baseline assessment as a way to understand oxygen access at different facility levels, and also the sort of procedures to go about that. So how resource intensive doing a baseline assessment would be, and what sort of different ways of going about it are in less resource intensive manners, depending on the level of detail that's required. We also had a discussion about different oxygen sources. So looking at investments in liquid oxygen versus things like PSA plants, cylinders, concentrators, and how to ensure that, you know, there is effective use of investment, that these devices last for multiple years, that maintenance is considered. Spike, want to add anything else to that?
Yeah, sure. It's just on the baseline assessments, really A lot of our work really starts with those baseline assessments. If you want to think about what the gaps are, where funding should go, how to allocate better, that starts with the baseline assessments. So every country will do this in a different way. Sometimes an online survey works quite well. Other times we find in-person enumerators to be much more accurate. But starting with the pilot, small scale, can be one good way to start building some political will to do this in a much larger scale.
Sorry, I was muted. Sorry, I was saying thank you very much, Ravi and Spike. And I'd like to give the floor, I think, to Carrie and Hannah, who are in group 1, looking at policies.
Yes, thank you, Pascal. So similarly to the other groups, it was really emphasized how COVID-19 really brought these challenges around policy, political commitment, and financing to the forefront. And one of the key things that we talked about that our colleague from Haiti mentioned was how to address these challenges, especially considering the already limited resources and competing health priorities that countries face, especially when there's broken or inconsistent ownership and leadership at the national level, and how you can move moving oxygen as a priority forward, given those additional constraints. So we talked a lot about the importance of advocacy and raising the awareness of the importance of medical oxygen as a treatment across different diseases and health conditions, especially when it comes to women's and children's health, and how the Oxygen Delivery Toolkit primer, advocacy primer, can serve as a key resource for some of the messaging and data that can really drive oxygen's importance forward at the highest level, to really kind of act as a launching point for countries prioritizing oxygen. So that was a really key piece that we discussed, especially the importance of using evidence and an evidence-based approach in advocating for oxygen, both, you know, using data at the global level like the primer does, and then also at the country level. So that kind of gets a little bit more into some of the other challenges that the group talked about in terms of use and need. And that also brought up another challenge on how there's a lack of capacity and knowledge within ministries of health on collecting data and having data around oxygen, and that can be a pretty regular and consistent challenge. And to really drive home those key messages at a country level, that data is really important for advocating both for improved policy and funding for oxygen. So that was another key thing that we talked about. And then one of the other things we talked about was kind of the lack of knowledge on what are the different delivery methodologies out there and what is the best way to move those forward, whether it's directly procuring equipment to deliver oxygen or renting equipment, and how do governments make the decisions on what's going to be the most efficient and cost-effective method moving forward. And we, PATH has our business models brief that we just put out, which actually gives a bit of an overview on those different options. So that is another resource that could be really helpful looking at some of those challenges. But those are some of the key things that we talked about in our group.